Most fillers are clear gels made of hyaluronic acid, or HA. HA is something that we all already have in our bodies. Hyaluronic fillers are made in a lab, and an HA is essentially a sugar molecule. But because our body burns sugar very quickly, in the lab they add links or locks between the HA molecules, so that now your body has to unlock these locks in order to break it down into sugar. The more links are added, the firmer the gel will become, and the longer it will take your body to break it down. In general, it takes your body about 9 months to a year to break down the filler. Usually, the thinner the filler and the more muscle movement that is in the area where it's placed, for example, the lips, the faster your body will break that filler down. There are many fillers on the market, and we actually carry most of them. We select the filler that is best suited to the area treated and that will give you the most natural results. We have a liquid called hyaluronidase. It's an enzyme, and it immediately unlocks all those locks in the gel and liquefies the filler into sugar water. We use hyaluronidase for many things, including hydrating babies, and it's actually often mixed with other medicines to help them spread better. Using hyaluronidase for filler reversal is considered medical standard, although it is off-label, meaning that the FDA did not approve it for that particular purpose. Hyaluronic acid filler can be used to add or restore volume in different areas of the face. In order to get natural-looking results, it's crucial to have an excellent understanding of the underlying anatomy and inject the filler in the right depth and in the right amount. Some of the areas that we frequently treat with fillers are smoothing the apples of the cheeks and restoring volume to the outer cheekbone over here, smoothing parentheses lines, smoothing the marionette lines and supporting the corners of the mouth, enhancing and smoothing the lips, adding volume and projection to the chin, restoring volume to the jaw, refilling hollow temples, filling under-eye hollows or tear trough, refilling deflated earlobes, and adding fullness to the back of the hands to make them look more youthful. Treatment with fillers can take 45 minutes to an hour, depending on which areas of your face are being treated. We start by taking pre-treatment photos, and the areas to be treated as well as some of the surrounding areas will be cleaned with alcohol and then sterilized with chlorhexidine. So it is very helpful if you can arrive without makeup to your appointment. Your doctor will then numb a couple of the spots on your face with a tiny needle. We then use a microcannula, which is a very thin, flexible tube with the blunt end to inject the filler under the skin. This does not hurt, and using a cannula significantly reduces the risk of bruising. Sometimes we also need to use a small needle to inject the gel filler, and in that case we use ice to minimize any discomfort. The areas treated as well as some of the surrounding areas will be numb for 1 to 2 hours. This is because the filler itself contains lidocaine. After the treatment, we will again cleanse the area and apply a soothing lotion. The results from the filler are immediate. However, you will also have some swelling from the injections and potentially some bruising. Some fillers also take several weeks to settle in. In general, I tell patients to wait 4 to 6 weeks before evaluating the result of their filler. In general, results last about a year and depend on how much filler was used, which filler was used, and what area was injected. Hyaluronic acid fillers come pre-packaged in a 1 ml vial. A 1 ml vial is actually only 1/5 of a teaspoon, which is a fairly small amount. So to put this in perspective, imagine a brownie recipe that calls for a 1/4 teaspoon of salt. Then remove some of that salt from that 1/4 teaspoon and you have 1/5 of a teaspoon or a vial of filler. So you need a lot of filler to get overfilled. We're pretty conservative in this practice, so in general, we will use 1 to 2 vials per area per session. For example, cheeks typically need 2 to 4 vials per session. Nasolabial folds will be 1 to 2 vials. whereas the lips will typically be just 1 vial. However, ultimately, how many vials and how many treatment sessions you need really depends on how much volume loss you already have and what your goals are. Injecting filler under the skin requires the use of needles, and as a result, there is always a risk of bruising, and you should expect some bruising. A bruise can last 2 weeks, so schedule your filler appointment accordingly. Taking blood thinning medications or supplements will increase your risk of bruising, so consider stopping them 1 to 2 weeks prior to your appointment. Some examples of these are ibuprofen, such as Advil or Excedrin, aspirin, fish oil, vitamin E, and vitamin D. You will not be able to apply makeup to the treated area for 24 hours. You also should not exercise for 24 hours or drink wine, as that can increase your risk of bruising. You should also avoid getting any dental work for 2 weeks before or 2 weeks after your filler treatment.